Hi, everybody. This is Dr. Eliana Aaron, Director of EMA Care. I hope everyone's doing well. Today is April 6th, and I want to take a couple of questions, but I really do want to show you some of the new developments that are going on right now and to discuss some of the trends that are going on in Israel, which is explaining some of the policies that are now being put into place. So I am going to show you our infection rate by city, which about every 2 days these numbers are coming out, and it's important to understand the growth factors that are here. So basically what we have is a significant amount of growth that has been going on in certain cities. Jerusalem is definitely one of them. Jerusalem has had an increase in the number of cases in the last few days. Bnei Brak had an increase of about 13–14% in the last 2 days alone, as did other areas such as Modi'in Elite, also known as Kiryat Sefer, had like a 21% increase over the last 2 days. And another hotspot is Beitar Elite, which is another problematic area. So what you're seeing here is this is representing a period of time between April 1st and today. So that's really only 4 days. It's actually, today's the 5th. I'm just speaking to you after midnight. So over the course of 4 days, you're seeing a really big jump. And we did predict this in Bnei Brak. And what we're seeing is in other ultra-Orthodox neighborhoods, especially poor neighborhoods, we're seeing these big jumps. And people have asked me, why is this happening there? Are they not compliant? And there's a lot of nasty things going around that are based on not understanding the population, and it's quite hateful. And the Prime Minister, among many others, have called for these nasty kind of discussions to end immediately, and these accusations. So I want to just discuss that briefly. Last week, when we started talking about an outbreak in Bnei Brak and in some of the other ultra-Orthodox neighborhoods, I specifically discussed that these neighborhoods are poor, they are overcrowded, and they do not have the physical capacity to quarantine people. It is not uncommon in these neighborhoods to have 7 to 10 children in a small 2-room apartment or 3-room apartment with their parents. And in spaces that are that tight, you can't quarantine anybody. It's impossible. So the government has come up with a process by which quarantine people can be removed into these hotels that have been converted to quarantine and low-level coronavirus treatment centers, so that they can get the care and the quarantine that they need to prevent the spread to the whole community. So I think it's brilliant that we have this option. Unfortunately, it may be late, and we may be seeing a tremendous increase in some of these areas as the removal process is going on of taking people and putting them in these safe places until they are past their quarantine date. So we do expect there to be spikes. Bnei Brak is currently on a complete shutdown as a neighborhood. And there is discussion that other neighborhoods, including Modi'in Elite, are going to be included in that in the next short period of time because of the same problems of overcrowding. Remember, this population has an average of 7 children. So they have a lot of children. They are poor. And I think Bnei Brak may be the poorest community in the country, or among the poorest communities in the country. And they need help. They can't do it. So I think it's great, and I think people should not be harsh and judgmental because of a few extremes, and there are extremes in every community. Because of those extremes, you should not be judging the whole community that wants to stay healthy, but doesn't have the physical space and ability to do so. So I want to make that very clear. Among other things I wanted to discuss today is, I'm just going to share my screen again. I wanted to show you this very non-impressive chart. This non-impressive chart represents the resolved versus active cases that we have here in Israel. So each day, obviously we know the numbers change, but each day we have 100% of the cases going on that day. So what we are seeing here is that the green portion, which is the recovered cases, is increasing, and very slowly this is going to start going down. The blue band, which is the active cases as a percentage, is going to start going down. And I'm going to show you what that looks like in Switzerland, because they are a little further ahead in the percentage of recovery as we have, and I'm going to discuss that in a minute. But if you take a look over here at this map, then you can see, I'll make it a little bigger, that this is the same chart basically in Switzerland. And what you're seeing here is that when this starts happening, we're actually going to start seeing it go down, and eventually there won't be any active cases at all. Everyone will have either recovered, hopefully, or there'll be deaths. So those are going to be the two possible outcomes here. So a lot of people have asked, what is Switzerland doing that's better than Israel? And the answer is nothing, okay? Switzerland has a mortality rate 6 times the rate of Israel's. Israel's doing a much better job. They are just in a different stage of this illness, but they had a significantly higher number of cases in the same period of time that we did. So we implemented a lot of the social distancing, the hygiene measures, the closures. We closed our borders very early. We were criticized for it here. And Switzerland was slower. They're also part of the EU, so there's an open border policy, and there's a lot of political ramifications. But, you know, considering that, they've had a huge number of cases relative to Israel. So while they are showing a higher percentage signs of recovery than Israel right now, their death rate is also 6 times our rate. Remember, our death rate is among the lowest death rates in the whole world. We're at 0.5% when the international death rate, and if you want to look at the honesty of reporting, then we're going to take that into consideration. The international death rate of all cases that have been diagnosed to date is 5.4%. So when we are talking about Israel being 1/10 of that, this is why Israel has been ranked the safest country in the world, okay? So Singapore has a similar rate, and they've pretty much, you know, stabilized at a very low number. And so comparing us to other countries doesn't always make sense, because the chart that I just showed you looks really nice, but when you look at the details, you realize that they have much higher death rate than us. Some people today have asked me about Sweden, because Sweden, you know, they have decided we don't need any social distancing, everything is normal here. And they don't have as many cases as Israel has. They have a slightly higher population. But if you look at their mortality rate, the mortality rate in Sweden is much higher rate than what we have in Israel. Okay, so when we go to Sweden right now, I'm just quickly pulling up those numbers. Sweden, the mortality rate is somewhere around, here we go. Sorry about that. 5.8%. So it's higher than, slightly higher than the world average of 5.4%. So what you need to realize is that Sweden, for a developed country, isn't doing very well. As far as the mortality rate, yes, their overall number is less than Israel, but in Israel, every life is important, and we are really, really holding on to make sure that we minimize our death rate, and because we value life. And if that means everyone in the country is going to sacrifice to save lives, we will. And we see countries that are doing that have a lower mortality rate as well. So just to give you an overview of what's going on today, I'm going to once again share my screen. And you can see here the total cumulative cases is now 8,430. And what we're seeing here, and it's important to understand, is that this is a pretty flat curve, okay? Israel, remember, just over 2 weeks ago, we were multiplying our numbers every 3 days. We're now at 7 days. So that's an excellent improvement. And that's because of the social distancing and all the measures that have been taken in Israel, which we are feeling emotionally, physically, but the results are right over here. So what we're seeing here is that if you take a look, this is 7 days. So you can see half of the rate we have today was on March 29th. So a week ago, we had 7 days, and that's a pretty good rate considering where we were 2 weeks ago. So I'm pretty happy with that. This number does not come down. You need to understand that the cumulative total is the best we can hope for is a flat line here, because it's never going to be less than 8,430 people that have had this. So it's not a chart that goes down. A chart that goes down is the epidemiology curve, and that's this, this chart over here. And this is telling us the new cases per day, and we can see that there's a pretty good chance that we're in a downturn now, but of course, this is exactly the right time for us to be even more vigilant and not to relax our guard. And the reason for that is because of another phenomenon called the second wave. And I can show you what that looks like. Probably tomorrow I'll talk about the second wave. But basically, an epidemiological curve, as soon as people start relaxing the standards and saying, oh, well, things seem to be getting better, so we're going to open up the borders, we're going to open up the airports, we're going to all go back to work, all the kids back in school. What you end up seeing is a second wave that could be higher than the first wave. So we're trying to prevent that, and that's why Pesach is so important for us to be home. And the last one I want to show you for today, the last chart, is the percentage of new patients is continuing the downward trend. Again, there's no such thing as a trend that actually goes down like a flight of stairs. I mean, it doesn't happen in reality. There's always fluctuation, but when we look at trends, we're seeing here that in the last week and a half or so, that we have a significant trend downward. We like that. We like downward trends when it comes to pandemics. So basically, that's what's really the most important thing. So when we look at how we're doing, there are signs of significant improvement. The government is doing a good job in trying to pinpoint the hotspots and to find solutions for those communities. There's more testing being done in the Arab communities, which is really good. Overall, I think that we have something to be optimistic about going into Pesach. I hope everyone stays healthy, stays safe, and stays home.